Hi guys, we're live again for our fertility Q&A, and we'll be joined by Dr. Kenneth Gelman in just a few minutes. We're hoping to answer your questions. It looks like Dr. Gelman, I see him here. He just needs to join our video under the IVFMD login, and we'll get started. Hi Lola, thank you for joining us. And if you guys have not submitted your question ahead of time, that's fine, or questions, you can go ahead and type it in the chat, and then we'll definitely get to that today. So I see Dr. Gelman's here under his Instagram, but I don't see IVFMD, so we'll give him just a few more minutes to see if he can switch over his account so that we'll be all on the same page, and then we can get started. Hi Jennifer, how are you? So I want to also ask if you guys, what you're going through, if you have to have an upcoming cycle coming up, or you just want to work with your fertility naturally and see what you can do to optimize that. We're going to be addressing it from both angles. So let me see, Dr. Gelman is still on his, I don't see him. I don't see the request here. So let me see here. He's under Broward Fertility. So Dr. Gelman, I see you, but you're still not under the IVFMD page, but we're going to go ahead and start anyway. Darn it. I wish that we could, yeah, maybe try again, see if you can log in again through that. So we're getting there, guys. We're having some technical issues tonight, but we will definitely get it straightened out. I want to welcome everyone. My name is Farah Duro, and I practice at Florida Complete Wellness in Southwest Ranches. We will be in our new location, hopefully in about 2 weeks, and our brand new office in Hialeah Gardens, right off I-75. So if you're in Miami or Fort Lauderdale or any of the surrounding areas, we have some patients from Naples, some patients actually from the Keys and all over, then you can hopefully find us a little easier. You're not going to be sitting in traffic very long, because our new office is going to be actually located kind of at the junction of the Turnpike and 75 and all those intersections. So we'll be more conveniently located. So I'm still waiting for Dr. Gelman to join us. If he could, oh, there he is. Yay. Okay. Got it. I have it now. Good now. So we're waiting for Dr. Gelman, and he is with IVFMD. There he is. Yay. Thank you. And we are going to be answering your questions tonight. So welcome, Dr. Gelman. Thank you for joining us. And welcome, everybody. Can you hear okay? Yeah. Okay. Well, I can't hear you for some reason, but maybe just see if you can turn up your mic a little bit, or, oh no. Okay. Well, let me see. Maybe it's me. It's probably me. It probably have. Okay. Just try again. Let's see. Okay. I'm going to turn up my volume. Okay. So, let's see. Can everybody hear me okay? Yes? Can you hear me? No? Oh no. Okay. So, let me see here. Okay. Let me try again. Okay. So everybody's good? They can hear me? Okay, Dr. Gelman, can you speak so we can make sure we can hear you? Oh, darn. Okay, so we're not hearing Dr. Gelman. Technical difficulties, but he's going to come back. So we'll see if we can get him back in a few minutes. So thanks everybody for your patience tonight. We're going to get there. So if you guys want, okay, we're going to go ahead and have him back and maybe get his microphone working so we can talk to you guys. Okay, so he's about to join again.
There we go.
Yay, we did it. Okay, thank you. Awesome. So we're here. We actually have a few questions that were submitted earlier, and we are going to get to those tonight. So would you like to introduce yourself, Dr. Gelman, for those who don't know you?
Yeah, I'm Dr. Kenneth Gelman. I'm one of the many doctors of IVFMD with many locations all over the Broward, Dade, in Jupiter, we're in Naples, we're in Viera, we're all over the place, all over the state. And I'm lucky, very happy to be part of that group. And I think it's a fantastic group. And we've helped many, many people. And we're hoping to help anybody else who needs help out there tonight with your questions. And obviously, if you're interested, we're happy to see you in the office or on virtual.
Very cool. We're going to give people a few moments to come in since we are having some difficulties in the beginning. So welcome, everybody.
Yeah.
And I think that here we are. We're in the end of August already, which is crazy. This year has kind of like flown by, but everyone's hanging in there. So whatever we can do to support you guys, we are really happy to do it. And we're doing these Q&As to support you, so please don't be shy. Send in your questions or type them in the chat and we'll get to them. We are going to be answering questions probably for about 45 minutes or so, sometimes to an hour. And so after that, it cuts us off. So definitely type them in as soon as you can think of whatever you'd like to ask. It can be regarding natural fertility cycles, pregnancy, getting pregnant, preparing for an IVF cycle, all those things. So definitely don't be shy. We'd love to help you. And I've worked with Dr. Gelman for so many years. He's extremely knowledgeable. I always learn, and I've been doing this for 20 years, and I always learn new things every single time. So, so it's a great thing that you're actually doing this with us tonight. So
no, this is great. I mean, this has just been, a real blessing. The one thing about this pandemic and the fact that we're all quarantined all the time, I mean, it's encouraged a lot of these things to be done. And actually, I never realized how valuable this technology really was. I mean, when we do not only when we do these are great, but even in the office when we do, and I'm sure you're doing them too, these teleconferences, on computer, they really work well. They really work well. And you can reach a lot of people wherever they are.
Yes.
We talk to people all over the world. It's just really pretty amazing how effective this technology is.
Yes, that's awesome. And I know that I've actually encouraged people that we work with in different states, even naturally, to contact you guys virtually because you can get all the blood work and everything done and ordered,
Yeah, I mean, it's so different these days, I mean, now you can really take care of patients anywhere. We have patients in Europe, we have patients in, the Bahamas or in Jamaica or, wherever. And, we can take care of them anywhere. We can send orders, we get them monitored, they fly in for the procedure and, then they fly back. So, I mean, it really becomes a point where there's no limits.
Yeah, awesome. So we are definitely would like to get started with our questions since we do have a few already. And the first one is, I'll just read these questions here. So it pertains to surgery. So this will be up to you if you're Ali. I had surgery 5 years ago for a tubal cut with an IVF. Can I get pregnant again? So I guess surgery, tubal, I'm not sure if it's tubal ligation or not sure. That's just basically what the question said here. So if you've had a tubal ligation, definitely IVF.
Of course. I mean, that's one of the best indications for IVF. Obviously depending on the age of the patient and what type of extent of surgery, that kind of thing. So you have to have, the operative records. You have to know exactly what type of surgery it was. I mean, there are some people who are looking for a tubal reversal. And if they're young enough and, we think they're going to get pregnant that way and they have, obviously decent sperm and they've had a surgery where it can be successfully reversed or they have a good chance of it, in some studies, there could be a reasonably good, very good pregnancy rate after a tubal reversal, depending on that particular process they had in the first place. But IVF is a great indication for somebody who's in that situation, because obviously you have built-in birth control afterwards. You don't have to worry about any of that. And, the advantage of IVF always over any kind of surgery, especially this surgery, is that you're going to cryopreserve fertility. You know, it's if you're fertile and you're pretty young and you have you make a lot of embryos, obviously, you will have embryos frozen, which is the greatest thing. I mean, what else can you cryopreserve in this life? Nothing.
Yeah, eventually we'll be able
And
to.
now your fertility lives on.
That's
And
right.
you know, that's the best indication for IVF. You
Well,
know,
that's why I
really.
think it's invented, right, for tubal issues, right? I mean,
I'm sorry?
was IVF invented originally for tubal issues?
Well, for tubal disease, yeah. I mean, you know, that's one of the chief, you know, reasons it was invented, so to speak.
Yeah.
So, you know, many years ago, anybody with tubal disease, you know, whether they've had old chlamydia disease or gonorrhea, you know, whatever it may be, they were infertile. What could you do for them? Nothing. So now, you know, with IVF in the last 40 years or so, I mean, those patients can get pregnant. So same thing with the tubal ligation. I mean, it's just, you know, it's you know, there's always a chance when you go in with a tubal reversal, for example, that the procedure won't work. You know, in 3 or 6 months, the tubes may close back up, or there's scarring or something else, some other complication. And many times it's not going to be covered by the insurance. So you might as well think about IVF, because you're going to, you know, take that money from the surgery, put it into IVF, where you have a very good chance of getting pregnant, obviously, and also cryopreserving your fertility. Well, how can you beat that?
We actually had that question from a patient last week about how she did recently find out that both of her tubes are blocked. And so her question was, you know, do I need to take my tubes out or not before I do IVF? And so I guess what factors would you look for if somebody, you know, as far as do they do this still? Are you looking for fluid leaking into the uterus?
Yeah, yeah. I mean, in situations where the tubes are damaged to the point where there's something called hydrosalpinx, that's a different problem. That's not, you know, from tubal ligation necessarily. I mean, that's from tubal disease, where somebody's had an infection, they didn't know about it maybe, or it wasn't adequately treated, and, you know, the chlamydia or the gonorrhea or whatever, you know, caused the infection. You know, I think it's about 25% of cases people can get that. It ends up scarring up the tubes, and the tube gets scarred and filled up with fluid and dilates, you know, because there's fluid in the tube, and then that fluid can communicate and cause, you know, implantation issues with embryos that we eventually, you know, want to implant in there. So, I mean, if you're going to go through a big expensive process and go through, you know, retrieval of your eggs and surgery and all these drugs, you want to make sure you have the best possible chance for success in implantation. So those patients, you know, would be advised to, you know, either cut the tube, you know, or ligate it and make sure that there was no communication with the uterine cavity, so it wouldn't affect any kind of implantation.
Okay, yeah, so that's important, because some people, then this patient said, well, how the heck did this happen? I didn't even know that I had anything, you know, that would have caused this. And that's the problem with chlamydia, is that it's a silent, in fact, like, you don't have symptoms, unfortunately. So that's why it's important to check the tubes if you're trying to get pregnant, even if.
Yeah, because a lot of people, you know, they say, well, I'm doing IVF. What do I have to worry about my tubes for? You know, and that's the reason. You know, we look for reasons that the tubes may contribute to a failure. So in other words, we want to make sure you have no obvious reason for implantation failure. So that's why we would look for that.
Right.
Or in an occasional case, you always want to know if somebody's tubes are open, for example. If they're maybe an older patient, they don't stimulate well, they end up with maybe one follicle or two follicles growing, and we don't want to go through a retrieval. At least you have the ability to maybe try an IUI. So at least you know the tubes are patent.
Definitely. And some people ask, can I try it naturally? And I think, you know, from our perspective, it's very difficult. You know, if you have one open tube, then that's good. But two blocked tubes, I'm like, go straight to IVF usually, because naturally it's very difficult. And, you know, sometimes they can, I guess, open up. Do you see that ever? Like where you
Well, it's not that. I mean, I think, you know, we see all the time where people come from other places and they've had an HSG, and, you know, one tube is blocked or, occasionally both. And, they really have no reason to have it. And depending what we see where the tubal blockage is, it might have been tubal spasm. So, sometimes these patients get sent to, they get sent to outpatient settings or hospitals, and, the patients are very nervous when they have that procedure. They all read the internet, and it says how horrible the procedure is because, maybe one woman had a terrible time, especially if the tubes are really, really blocked, truly blocked, and the doctor's trying to push the dye, against an obstruction. It's painful.
Yeah.
It really is. So somebody reports that on the internet, but that may or may not be this other woman's situation. And sometimes we reevaluate them. We may want to say, what, maybe we should try this again. In our settings, and typically, I know when I do it myself, I usually do it very gently, a gentle HSG. But I always, sometimes give Valium ahead of time or some kind of drug to really relax the person, because it really helps. It really helps. The tubes are muscular, so Valium is going to help. So we give them a Valium, make sure somebody drives them that day, and it tends to really make a difference. And some of those patients definitely don't have the blocked tubes that they thought they did, or one tube is open that they thought was blocked. And that's a big relief for a lot of people.
Awesome. Well, we have another question about basically what diet should you be on to ensure that the embryos stick when doing a frozen embryo transfer?
Well, I think diet is key for whatever you're doing for IVF, but obviously once you're getting pregnant, we got to make sure your BMI is at a good, safe level to get pregnant. We're trying to encourage a healthy pregnancy and a full-term pregnancy as much as possible. But, I think diet in terms of reducing any inflammation in your body. So a lot of times we may order a inflammatory panel, particularly looking at a very important test is the HSCRP. I think that's a very sensitive test for inflammation in your blood vessels. It's a protein that elevates if there's, inflammatory disease in your arteries, typically from insulin resistance or prediabetes or, maybe high cholesterol or triglycerides will, do those kinds of things. Those are markers for problems in your blood vessels. So we would, encourage those people to try to normalize these things before they even try to get pregnant or get a frozen embryo transfer. So a lot of times we'll send them to our lifestyle specialist to help us. But, we'll try to make sure they're on fish oils, eating a lot of salmon, eating a lot of quinoa, broccoli, Mediterranean type diet would be ideal. Less red meat or no red meat at all, those sodas, things like that.
For both couples, both partners, right? I think like
both
improvement with sperm quality.
Sure. You get healthier sperm too. We don't, of course, we don't want to neglect the men here. But that's true. So both of them, it always helps when you have somebody else with you doing the same thing, exercise, yoga, all those things are very important. But I think looking for inflammation specifically and making sure they don't have that, and encouraging a healthy Mediterranean type diet would be ideal.
Yes, definitely. So and we try to emphasize that too, because that's food is the first medicine, really. So that's important as well. And there's been research on the Mediterranean diet. We talked about this a little bit in our earlier Q&As about the study from Greece, where they showed that couples in their mid-30s were actually getting much higher success rates when they were implementing the Mediterranean diet. So we just, give some examples to our patients to follow and that sort of thing. But it's most people are pretty good with just having, fruits and veggies and some seafood. Like they can handle that. And most of the time, everyone we see, they want to do as much as they can to make that cycle as successful as possible, because it could be that this is the only cycle that they can do. Or
that's correct. So that's why it's very important to counsel patients about that part. There's certain things we can do, and we can, and I tell all the patients, IVF is only as successful as what you give us.
Yeah.
So you know, we're not creating new eggs. We're not making all these little eggs that you never had show up in your body just because we're giving you injectable drugs, you know, that kind of thing. We are just recruiting what your body has already produced, and what we grow in there, because you had them in there to begin with, is what we're going to get. So if your body is exposed to a lot of bad things, we may get bad eggs. You know, we may have poor fertilization, we may have poor implantation, we may have all those things. So that's why it's to the patient's best interest, if they follow a diet and they stay healthy and they do the things that, you know, we think are best, because, you know, this is a big deal. This is a really big deal. It's a very expensive thing, and it's very emotional, and, you know, time consuming. You got to miss work, maybe you got to, you know, leave work early, you got to do things. It's tough.
Yeah,
So,
a lot
you
of
know,
information out there that's very confusing. So, I mean, there is actually some doctors that are promoting do all keto, do this, do that. And it's like there's so much overwhelm. So,
yeah,
we try to actually just do things that have been well researched, that are going to be helpful, that we know throughout the years have worked. And most people do really well just getting their inflammation down, which,
yeah.
if you're sticking to an anti-inflammatory diet like the Mediterranean, I think it goes a really long way.
Oh, it really helps. It
Yeah.
really works. It really works.
And
There's no
you've worked
question.
with PCOS for so long, and you know, people that are pre-diabetic and all of that. I know that you focused a lot before on glucose and working with that, but you also see that it's a much bigger picture when you get into the numbers a little more, as far as the inflammatory markers that you guys are testing for too. So
Yeah, I mean, you know, I mean, we see things like, you know, particularly endometriosis patients, you know, we look for certain markers there. So we try to reduce those also. We follow those, and we know, you know, we think that that's, you know, one of the things that we can use to help, you know, say that, hey, you know, you have a better implantation potential here if we reduce your inflammatory markers. So, you know, not only for just, you know, pre-diabetic or high cholesterol, things like that, but in endometriosis patients too, we try to reduce the inflammation there.
yeah, definitely worthwhile. And so our focus usually is to have a healthy pregnancy. And I tell
Yeah,
them it's not necessary to get pregnant, but to actually have a really healthy pregnancy and
yeah,
an enjoyable one, so that you're not in pain and you feel good. You know, we work with our patients. We have the advantage of working with them throughout pregnancy and into labor sometimes, or and to actually pre-labor. So that's the fun part. And we try to emphasize that acupuncture should be done twice a week up until the ultrasound showing the heartbeat, because at that point, after that time, you know, you can agree the miscarriage rate goes down dramatically after you can visualize a heartbeat. And then during the first trimester, we focus on nausea, vomiting prevention, working
yeah,
with balancing hormones, helping with circulation, back pain, neck pain, all of those wonderful things that can go along with
yeah,
pregnancy. And two, like you're basically getting over the whole part of, oh, I'm getting all the stress that has been building up for this whole IVF process, and now I'm pregnant, and now I'm freaked out that I'm pregnant. So, you know, so there's like kind of like the stress doesn't really end with the transfer, we say. So, you know, work with just getting to the point of being able to enjoy their pregnancy. That's really the most rewarding thing for us. And I know that they can still see you guys till they're about 9 weeks, right? So
9 weeks,
there's that.
9 weeks, occasionally 10. Yeah.
Mhm. So, I mean, that's a relief to a lot of patients. They're like, okay, I don't have to like search for an OBGYN right away. Like I can still see you guys and still work with you until you kind of graduate from the IVF clinic. And then,
Well, it's good and bad, you know. I mean, you know, we kind of baby the patients a lot, you know, and they get
Mhm.
very used to coming in once a week once they're pregnant for ultrasounds, and we follow them, you know, through, you know, weekly from, you know, week right till week 9 or 10. So they may have 3 or 4, sometimes even 5 ultrasounds before they leave us.
Yeah.
And the patients, you know, don't like to leave us, and then they go to the OBGYN, and they may get one ultrasound, you know,
All right.
one another a month later, you know, and that kind of thing. So it's a little adjustment for them once they get over to the OBGYNs, but they, you know, after a while, it's fine.
Right. We also have to say,
But
during natural pregnancy, you're not really like getting many ultrasounds. Like,
no, not at all, not at all. I mean,
ew, like,
the IVF pregnancies are very highly scrutinized.
yeah.
Everything is scrutinized, so that, you know, everything is, you know, all your I's are dotted and T's are crossed. So it's much different than a natural pregnancy, much different.
Yeah. So our job is just to actually help prepare you for that, and as and your partner as well. Sometimes we do treat both, and then kind of work with whatever treatment plan you've been giving them to help with implantation, with stress relief, blood flow, all those good things. And in general, there is a question about are there certain points that can help target egg quality? And I think they're referring to acupuncture points there. So I'll take that question. Someone submitted earlier. It's basically we look at your tongue pulse, and then we also look at areas of blockage. To us in Chinese medicine, if your periods are clotty, if they're kind of on the darker side, it's really an indication that we need to improve blood flow, improve that circulation. And the better the circulation is going into an IVF transfer and going into pregnancy, we think that actually shows us some progress in Chinese medicine. So we want to make sure, and that's really one of the biggest problems we see, is just poor circulation a lot of times with our patients who are coming to us for a few months prior to prepare for IVF. So we look at the period like a report card. So it's really important to us. It might not be important to a lot of other practitioners, but we want to know like everything about your cycle. So we'll say, okay, well, how many days do you bleed? Like, what's the cycle look like? I mean, do you have pain? Are you feeling, cold during your cycle? Or how about, the circulation of your feet, the blood flow to the feet? So all those things matter to us. And then they can back it up by, there was research about using electroacupuncture in a fertility clinic that used Dopplers. They actually measured the blood flow to the uterus and how that increased with certain types of treatment with acupuncture. So in general, long story short, those points that actually increase circulation are all also the ones that we use to help in general with egg quality, because the more the better, in our opinion. And also we use Chinese herbs as well in certain phases. We're not going to use them usually during a medicated cycle where you're on fertility medications. That's usually way before that happens. So if you're coming into an acupuncture clinic like the day before a transfer, it's kind of like, well, we can help with the stress relief part, but we needed more time. So I really, really emphasize that if you have some time to prepare, at least 4 weeks, give us at least that time.
Longer. I would say longer.
I love longer, but
I would say longer. The longer, the better. Yeah.
And the biggest complaint we get is like, oh, I wish I'd known about this sooner. And sometimes, that's why we're doing this too, is to also get the word out that there are things you can do at least like 6 weeks prior. If you have, 4 to 6 weeks, that's wonderful. And I think you have seen throughout the years that the benefit that happens when someone is using that, as opposed to like.
Oh, no question. I mean, every patient that comes in and you ask, are you doing acupuncture? Yes, I am. And I love it. They're so much more relaxed and they feel better. And a lot of people say they can't wait to get to the next treatment. Once they get over the initial, maybe, feeling that, oh my God, I'm getting stuck with needles, a little phobia, but it's really nothing, and they find out it's so relaxing and so beneficial to them. It adds a whole new dimension to this.
Yeah. And the needles are the size of your hair, so they're really thin. So I would say, so there are acupressure points that we give sometimes for patients if they're traveling and they're like, oh, I can't make it to acupuncture. I mean, there's different things you can do, but it is cumulative. So that's the thing I've noticed too, is if you are experiencing a lot of stress in your life, or you're feeling that you're a little overwhelmed, start acupuncture.
For sure.
Will be there, but
it's so beneficial. It really helps. Yeah. It really, I mean, we see patients all the time and who go through this. And I think it's such a beneficial part of our field, what we do. But and also in terms of that question, they may be talking about, can you actually improve poor egg quality? Can we actually improve it? We really can't improve poor egg quality. I mean, if somebody is 41 or 42, I mean, egg quality is going to be a problem, and that's a biological fact. I mean, that's called biological aging. Where egg quality just isn't the same as it was when you were 21. The eggs just don't divide; they become brittle. They have issues in the chromosomes, things like that. But the goal that what we all try to do is, by increasing blood flow and all the things you do is, and also we add maybe supplements.
Antioxidants.
such as like DHEA and strong antioxidants, is to try to help improve the environment in the ovary to sort of make it younger, I guess is a good word, so that the environment of the ovary helps encourage the good eggs that are left in there, and to come up to the surface so that we can recruit them. So we're not improving poor egg quality. There's going to be poor eggs in there. We're just trying to get the good ones
right
to come up to the surface so that, in the group of eggs that we recruit with fertility drugs, we get the good one in there or two. So, somebody that's 42 years old, and maybe had several failures, and then, we put them on these supplements, do acupuncture for a few months, and they come back, they do another cycle, and they get one normal embryo genetically by PGT. That's a victory.
Mm-hmm.
That really is a victory. And we have to sort of convey that to people that, that's really what this is all about, is trying to sort of sort through the ones that are no good and get the good ones there by trying to improve the environment and the health, reduce inflammation, all the things that we're trying to do to try to get those good eggs to remain there so that we can recruit them.
That's awesome. Yeah. I always visualize that follicular fluid can be malleable. It can actually change. So when you're putting good things in your body and good nutrients and good antioxidants, you can change what those follicles are bathed in. So that can also help with growth.
Well, listen, it only makes sense because, you read, these books and things like that. I don't know if anybody's ever read the Whole Foods diet book. The gentleman who started Whole Foods, I think his name is Mackey. It's a very good book. It's got a lot of recipes in there too. But he tells some stories in there, some amazing stories of people who actually reverse their heart disease, where they've had blockages and things like that, their coronary arteries, reverse them completely with diet, without drugs, without statin drugs, without this, without that. Well, if you can do that,
right, you
can do a lot, with your other parts of your body, which are all in the same body, fed by the same bloodstream.
Definitely.
So diet is a big part of this. We can't overemphasize that.
And just like, things that can harm egg quality and sperm quality, by smoking and drinking.
Yeah, well, sperm for sure. I mean, we know for sure that heavy smokers and heavy drinkers, the DNA of the sperm just gets battered, gets beat up. I mean, if you look at sperm under the microscope, you can see it. I mean, there's special stains they can do. And the special tests, like what's called sperm chromatin structure assay, we can send that out. It actually looks at how disrupted the sperm is, because male factor, may be leading to poor embryo development, and I just had a case of that the other day where I had to, tell them that it was definitely due to male factor. It was very clear.
How do you determine?
Well, because the embryo just didn't develop after the third day. When the male genome activates in the embryo should, grow and develop, and the embryos really just didn't go anywhere. So we know it was, and the egg quality looked good, when the egg quality, and it was a young patient, so we know it was male factor, and we know it was poor sperm. He had testing beforehand, but we decided to do ICSI, where we inject the sperm in the egg, and the embryo quality was poor. So we have to kind of go back to the drawing board and make sure this person's as healthy as can be. Or sometimes we have to use testicular sperm, where we actually have to go into the testicle and take out sperm because of the fact that the ejaculated sperm, or the sperm that's more exposed to reactive oxygen species and things like that, get battered. So the sperm in the testicle is more protected. So sometimes we use that, and with better success. So male factor is part of this, and we can't neglect the men. Like I said before, that's why we got to do a good semen analysis. You have to have a good one done at an andrologist's office, such like we have, where your sperm can really be scrutinized. So we know what kind of sperm quality we're dealing with.
Yeah, very important. Yeah, and definitely it is kind of overlooked sometimes, but yeah. And so as far as we have one more, two more questions. Why are doctors against embryo transfers? I don't know if that's maybe like a fresh embryo transfer. It just said, why are doctors against embryo transfers? But
Well, no, nobody's against embryo transfers. I don't know what that.
yeah, I'm
Maybe
not sure.
maybe a
If,
fresh transfer.
if they're watching Candid Emo, just let us know if you want to clarify that. That would be great. But yeah, I mean, hey, maybe we can talk about the difference between the fresh and frozen now, as far as what you guys are seeing, embryo transfers or.
Well, we're doing mostly frozen transfers now. I think some of the studies now are showing a higher pregnancy rate
Mhm.
with frozen embryo transfers. And then, like we've discussed several times on this, I think, you can control the environment around a frozen embryo transfer better than you can with a fresh. A fresh means that, you're stimulating the patient, you're taking the eggs out, fertilizing the eggs, and then you're putting them back in 5 days later if you have the embryo, all kind of in one sitting. Versus, a frozen embryo transfer where you do the IVF in two parts, where you can take the eggs out, the first part, fertilize them. And a lot of people now are getting PGT biopsies on those embryos to see, are we placing back genetically normal embryo with a, 95 to 98% accuracy from, and I made that point on purpose because it's not 100%. And then they has the ability then to check those embryos genetically. So you have to do a frozen embryo transfer because it takes time to get the genetic studies back. But, with the frozen embryo transfers, you're transferring them more in a sort of a normal, natural environment. And, some people are actually doing natural cycle transfers for that reason, where we just let the women ovulate if they have a regular cycle, and then we transfer them, so you have that ability. And you're not, subjected to all that high estrogen and advancement and changes in the endometrial lining that could happen with a fresh transfer. So we sort of getting away from the fresh transfers, more into the frozen end of things. There's all other tests you can do now, ERA testing, things like that. That gives us a better idea about what day to implant the embryo. So you have more control over a frozen cycle, and you have more ability to sort of help improve implantation better. Let's put it that way.
Looks like we have another question about when it says, when can it be helpful during IVF? I guess it's talking about acupuncture, I would think. But like we talked about earlier, we tend to try to encourage our patients to come at least 4 to 6 weeks prior to the beginning of the medicated cycle, whatever they're doing, either fresh or frozen, or even IUI as well. And we see our patients twice a week, at least twice a week, during that particular time, during that 4-week period, and during the IVF or the IUI cycle. And then we actually continue twice a week until the ultrasound shows a heartbeat usually. So with the frozen cycle, we still do the same thing usually twice a week, at least 4 to 6 weeks out. And again, some patients will just want acupuncture at the transfer. That's also, it's very helpful. But I haven't seen, I have seen it work very well, but we definitely see a little more success when they are starting acupuncture a little earlier. And, we had an experience with that where we did see the patient with, we did acupuncture during the transfer for both of the children that she had, number 3, and we had done acupuncture the 6 weeks prior to that. But the third time we went to the transfer, we were not seeing as good of success. We didn't do the acupuncture prior to that. And so just only at the transfer. So, I just feel like in my heart, I really wish that everybody could start, like you said, a little earlier, just to get the benefit of working on things that we need to. It's kind of like building a house. You want to lay down that foundation first, and then you want to build everything else. But we don't want to start putting windows and doors until we put the foundation in. So that's kind of.
Yeah, it's part of the process. It really should be considered part of the process, just like you would, take your injectables, you would, follow a healthy diet. You go to acupuncture, you get acupuncture to improve your success. You want to improve your success. I mean, why wouldn't you want to do that? And again, I think it's very important you stress that, I think the 6 weeks, but also very importantly, I think the time of the transfer is very important to have acupuncture.
Mm-hmm. Definitely. And we, always emphasize that, if you can try to, I mean, we will be there whatever day it is. We're here every day but Monday pretty much, but we still meet your patients at your center on Mondays as well. So we're very flexible with that, but you're one of I think one of the best options you guys have is that you give your patients every tool imaginable. Like, you have counseling, and you have lifestyle, and you have all those tools available for them to succeed. So when you check your success rates, and I checked them the other day and I was like, yay, they're excellent. And I think that's because you do provide all those tools. So
yeah, it really helps. I mean, it's just, maybe we overwhelm the patient, because we give them so many things to do. I'm sure that's part of it, because, people are working, and, it's very difficult now with jobs and things like that. And, so it's hard, and that's why I said, try to maximize your success, and so that you can be successful. You don't have to do this 2 or 3 times, and all these things are there for you, especially the stress reduction, the diet, the counseling, all that we have available. So I think I would, encourage all the patients out there to take advantage of that.
But we do have a question pertaining to sperm quality. So what's the process used for using sperm for ICSI? Is there a way to get the best sperm so that the embryo can develop the way it should?
Well, it's the embryologists really handle that, but they have a new sort of sperm wash that we're using specifically for that. It's called the Zymot method, which actually is, it's less aggressive than a typical sperm wash that's been done over the years, where they put sperm through a column and get centrifuged. And the more active sperm comes out, and then, the best looking sperm, so to speak, are picked. There's no magic bullet anymore in terms of, we can't say that sperm right there is going to have perfect DNA and that's the sperm we're going to use. We don't have that ability. But with the Zymot method, the sperm is put through sort of almost like a fish netting. And the more active sperm will swim through the netting, and the more active, better quality ones will remain, for use after the netting. So those are the sperm that are basically used for the ICSI process. So it's a little less aggressive in terms of, beating up the sperm, so to speak. And, we think that should improve embryo quality, or give us the best sperm for the ICSI procedure for embryo development.
Now, do you guys maybe you have a few embryos you could do half ICSI, or you have plenty of follicles to choose from? Do you do half, like natural fertilization, I guess?
Sometimes, I mean, especially if they're proven donors, you could use, natural fertilization to a certain extent, but, we may want to add some ICSI. I mean, it depends on the situation of the couple, if they've had kids or not, if, they're proven or not. So, a lot of that will depend upon the analysis. What we think is the sperm disrupted? Does it look poor? Even though he's proven 10 years ago, I mean, maybe he's got a very poor semen analysis now. Do we really want to do natural fertilization? That kind of thing. So there's all sorts of decisions that I think have to be made depending on what the data shows.
Very cool. Well, I always wanted to, like, how do you see or how do you choose? There's so many of them.
Yeah, well, that's the embryologist's job. We don't do that. I mean, that's what they do. They're miracle workers. I mean, they're very, very, very hardworking people that know what they're doing, and they're very experienced. And they've been doing this for years. And believe me, when they say, this sperm is poor, or this, the egg quality is great, and this embryo looks great, it's true.
Awesome. And we do have a question that popped up. What acupuncture clinic do you recommend in Miami? And we're actually moving to Miami in 2 weeks, so we'll be in Hialeah Gardens. So it depends on where you are in Miami. We'll be there across the Broward Miami line, and then we also, if you go to aborum.org, there's a website there where all fellows for reproductive acupuncturists are listed, and for that we take a certain amount of CEUs in reproductive medicine every single year to remain certified, and we take a certification exam in Eastern and Western reproductive medicine, and that's part of our certification. So if you go to that website, I will type it in here. You can actually go type in your, I think your state or your zip code, and it's actually going to pull up those acupuncturists that are working with, oops, let me see here. I'm typing it in as I'm talking, working with reproductive medicine. So went ahead and there. Yeah, and we are going to be in, so I'm not sure where you're located in Miami, but we do have patients who come from Miami Beach and from other areas. The clinic that our own clinic that we're actually opening and moving to as of September 1st, we're crossing our fingers we can be in there September 1st. It actually is near the Turnpike, 75, the Gratney, and Okeechobee. So it's like all of the major intersections run right by our office. So that is a 20-minute drive from South Miami, 20 minutes from Cooper City, and it's about 30 minutes or so from Miami Beach. So it's pretty close. So anyway, we're here Tuesday through Sunday, and then we know that there are clinics just in your area. You just have to search and look and ask that person, hey, how much do you work with fertility? And if they're on the ABORM site, they're definitely working with IVF clinics. But you want someone who speaks your doctor's language, who communicates with your doctor. Like, I probably bug the crap out of Dr. Gelman because I'm always texting him like, hey,
no, that's
so,
what makes you so good. I mean, but we know each other so well.
Yeah, like
we know each other's work so well. So I would always recommend Farah. If you guys are looking, I mean, it's worth the drive.
Thank you.
So it's really important to have the right person who knows the field. It really is.
Even as long as you and I have been doing this, it's like there's always something that pops up. So it's really good to be on the same page as that practitioner. So if you have a great team, it makes life so much easier when you're starting.
It is, especially if the doctor knows the acupuncturist well, like you and I do. Because, there's always questions that come up because you always, like you say, you text me when somebody's there and you have a specific question about any specific thing you want to start or whatever thing. It's always very quick because we can text each other up and back and say, yeah, that'd be great. Yeah. Please do that, that kind of thing. So it really helps the patient,
And you like so fast usually too. And our patients love it too. They're like, Dr. Gelman always gets back to me so quickly. I'm like, it's so important. So, just try
to even email, even answer emails. Yes, I do.
Yeah. So I'm like, you must have an assistant that's helping you because you're fast,
I don't. I just, I sit there with my phone and, if I have a minute, I just do it.
Awesome.
I don't like waiting. I just like taking care of people's problems because I know if I was in the same position, I'd want my questions answered. I don't like, waiting.
Right.
And
then, so there are actually, interestingly, nothing's popped up about getting pregnant right now during this pandemic, but things are changing. Hopefully the numbers are looking a little better. Maybe things are going
I think they are, which is good. Obviously you still got to be careful out there, and we're still going to be careful right through, we know that this thing is 100% clear, which I don't know when that's going to happen. I have no idea when they're going to actually end this thing and when this thing is going to go away completely. I mean, I guess once we have a vaccine, if that's effective, who knows? We don't know. We don't know anything.
Until then, support your immune system. Try to stay healthy, eat well. See Marta. Marta's here.
Marta. Yeah, you got to help everybody out there. You got to keep everybody's immune system up there, Marta.
Yeah, I know. I'm popping my vitamin C every day, my D.
And zinc.
And zinc, yes.
Zinc.
Yeah, my little cocktail in the morning. But
I mean, there's been some studies on vitamin D. I don't know for sure whether it's real or not, but vitamin D might be a very important part of this in terms of blocking the virus entrance into certain lung cells, things like that. I don't know whether they're ever going to publicize that or whether it's real because vitamin D is so cheap.
Yeah.
And I don't know.
Couldn't hurt, right?
There's some interesting data. It can't hurt.
Yeah.
So make sure you're getting your vitamin D.
That are treating, patients and they're calling us saying, this is what we do every day. We go into the hospital. We just, get our vitamin D going and our C and all that. And wearing masks, washing hands, all those things. But
Yeah, yeah,
so thank you for someone who said that they have great communication with us. We try our best, and we really appreciate that.
yeah, we do.
Yeah, for sure. We love all of you, and I really
Yeah.
can't wait to hear more from you guys. If you still need to have your questions answered, we're kind of running out of time. We have about 5 more minutes, so we
Yeah.
can answer
Come
any
on,
questions.
ask people.
Yes, challenge us. All right.
Doesn't
So,
matter. Doesn't matter what it is.
okay. Yeah. Any question about life in general?
Anything, anything.
Ask anything. So if you want to go ahead and get your question in now, we can do that. And if you want to go ahead and send us an email or something, you can reach Dr. Gelman at the IVFMD website. I believe your email's there.
It's yeah, it's dr small dr dot gelman at ivfmd.com.
Dr. Gelman, yeah, Dr. Gelman at IVFMD.
dr.gelman at ivfmd.com.
Oh, yeah. Yeah. And he does respond to email, as we know.
Yes, I do. Yes,
Okay.
I do.
Yeah.
I certainly do.
If you have a question here, are natural killer cells important?
Yes, they are. You know, again, it depends who you talk to on this, but you know, we firmly agree that in our practice that is an important part of implantation. You know, it's a very complicated area. It's a very, very complicated area. And, you know, specifically what brings natural killer cells down. But natural killer cells are important in implantation, you know, but if they're overactive, for example, if we think you have immunologic losses due to, you know, overactivated natural killer cells, then we're going to end up treating you, you know, with several drugs, most notably intralipids, lipid infusion, which actually tones down the activity of the NK cells. Very safe, very easy to do. And some people who have more immunologic problems, specifically they have very active thyroid disease and natural killer cells that are elevated, they've had a history of miscarriages, they may get something more complicated, maybe IVIG infusions, which are gamma globulin, to help reduce the natural killer cell function from over interfering with implantation or causing implantation failure. You know, diet, I'm not sure much in the way of diet other than, you know, healthy diet and keeping yourself healthy. But, you know, if you have an autoimmune disease or something else causing this, you know, it's nothing you did, it's just, it's a disease that's doing it, that we have to control the disease. So sometimes, you know, steroids are needed or other anti-inflammatories, things like that. But, you know, I think it's a very important part of this. And a lot of times before frozen embryo transfers, which is another reason why we do a lot of frozen embryo transfers, we check natural killer cells on people to see, you know, or, you know, to say, well, listen, maybe we should give you intralipids, which is, again, a very safe, easy treatment to help prevent a miscarriage or implantation failure on that basis. Because, you know, we don't want to go back after a failure and say, oh, you know what, you had natural killer cell elevation, we could have prevented this, you know, from happening in the first place. So, you know, a lot of times we do look at things like that. So that's a good question.
And I recently took a course on autoimmune infertility, which was interesting because we're still learning about it. There's a lot of things not known. But, you know, someone just asked, what else can we do to prepare for FET with immunologic infertility besides diet? So there are a few things. Number one is sleep. And I know it sounds really simple, but they've actually shown that actually can modulate the immune system, can help a little bit if you can get to deep sleep. And I know melatonin.
Melatonin, I was just going to say that.
Yeah, that can actually improve. I mean, there was a study that actually showed that it actually helped the response in IVF and that sort of thing too, when I believe it was combined with myo-inositol. So those things, and also we actually have had patients who have done acupuncture and we had a patient who would test her own natural killer cells. Like she was actually repeatedly getting testing. She was a doctor and working at a hospital. And when she had acupuncture, they would drop. Actually, they would kind of modulate. So it was interesting because we treated her during her pregnancy where she would track that. And I thought, this is such a cool informal study, but, you know, the way that we work with that, how we view acupuncture is it provides homeostasis. So it's kind of giving the body what it needs. If someone who has compromised immune systems actually do acupuncture, that can actually help. Their studies show that certain points can boost T cells and help with the immune system. And those that are actually having autoimmune issues, those are things that actually we can do to modulate the immune system as well. So it's really cool. That's kind of why I think acupuncture is such a safe treatment, because it's one of those things that can help in either direction. But definitely we work on stress relief. We work with guided imagery, meditations during the treatment. And those, there are a few supplements like N-acetylcysteine also that can be helpful. And there's research on that as well. So we try to incorporate everything we can that can actually do no harm.
There was a question about how much melatonin. I don't know if there's a definite answer on that. I've seen several studies. I think one was 3 milligrams, another one I think was 6. But it depends on your tolerance of that drug, because it's not a drug, but some people are very sensitive to medication, and it may really kind of make you very, very groggy and tired, that kind of thing. But I would probably start low, maybe on 2 milligrams a night, and see how that works, and maybe work it up. But you'll sleep better. That's for sure. You should sleep better. Yeah. Which is what we're doing it for. You don't take it during the day. It's for sleep.
Right. Well, yeah, that definitely. And for some patients, it doesn't have a whole lot of effect, but others, they're like, oh, that was like the best sleep I've ever had.
So some people take 10 milligrams. I've seen 10 milligrams. Some people have to take up to 20. I mean, there's people that take very high doses of that, but I think they mainly have a sleep problem more than anything. Sleep problems are very common. So that may be why they're doing it. But I think, there's no definite study on how much melatonin will improve egg quality, things like that. But I've seen a couple of studies of 3 milligrams, 6 milligrams.
Right.
Some anecdotal studies.
Very cool. So these are great questions. And then I think also, anytime you're looking at the immune system, there's always a complicated answer. I mean, there's never a straightforward, you can just really go down the rabbit hole. But I really think that going back to the basics and just trying to eliminate as much stressors as you can in your life is really helpful. You can't avoid stress altogether, but you can try to eliminate things that might be causing you stress that you really shouldn't have to deal with, don't need to deal with during this particular time. That could include some stressful people as well. So, a little bit of detoxing there, if you can.
Right.
So should men also do acupuncture during the cycle? I would love it if more guys did. I mean, we just don't see them as much. We would love to. We do encourage them to come in. What are your thoughts on that, Dr. Gelman?
Well, I think it would be a good thing if they did it. I think men are sort of a different animal in a sense. I think a lot of times we're lucky that they even come into the consult, but when they do and they're interested, I think it would be a good thing for them. And I've suggested it many times for them because it is definitely good for stress reduction, and stress can cause abnormal sperm production, abnormal sperm counts. So I think it would be a good thing for men to continue, to consider. But, I mean, it's tough to get men to do things. But, I think we would encourage them to. And I've seen on some occasions where acupuncture helped improve a guy's sperm count.
Right.
And maybe it was the stress reduction, things like that, all the counter-regulatory hormones that are affecting things, because when cortisol goes up and things like that, or, weight, when you have extra weight, you have extra estrogen, things like that. But stress, cortisol causes extra weight and things like that. And when you have that stress, you reduce cortisol, things like that, your pituitary functions better. So that will tell your testicles, hey, work better.
Awesome. Yes. And we are running out of time, guys. So it has been so much fun talking to everybody. And Dr. Gelman, thank you as always.
My pleasure. It was great. We'll do this again.
Yeah. Well, hey, we're here every month. Next week we'll be with, I'll be speaking with Dr. Wood next Wednesday. So if you didn't get your questions answered, please type them in and we'll answer them next week. And then Dr. Gelman again, we will be back in September. And hopefully I'll be coming back from our new office. I can take you guys.
Awesome. Awesome.
So you guys so much. And you can go to Florida Complete Wellness or IVFMD for more information. And we look forward to seeing you guys next time. So take care, everyone. Stay
Thank
healthy.
you. Thank
Okay,
you.
bye.
Bye bye.